I'm Dr. Beard. I have a concierge medicine practice, and Paul is my husband. And I'm going to do a little quick skit, kind of shows how most of you know healthcare goes these days when you're at the doctor. And then we'll come by with sharp contrast of how we like to do business at Hippocrates Health. So.
The reason we do this is as the government takes over 1/6 of the economy, this situation we think will be exacerbated as if we go towards a single-payer system. And what we're doing is contrarian to that. We think it's the way to practice medicine. And this little sketch just to demonstrate the way things are now and how we think will even get worse as we move forward.
A little humorous sometimes.
Did you make it back from lunch?
Yes.
You know,
Didn't have much of one. I had to catch up on paperwork.
well,
It's never ending.
It's not going to get much better, doctor. I got every room filled, and there's 10 in the waiting room.
What? It's not even time to start yet.
I had to book. You know how things are right now with the expenses. We went over this. I mean, things are a lot different than it was 20 years ago when we started.
I know. It just seems like we're doing more and more. I'm seeing more patients just to pay the bills. There's more paperwork. It's never ending. What gives?
I ran the numbers last night like you asked me. From when we started to where we are now, we're seeing 3 times as many patients, and we're bringing in half the revenue, and our expenses have doubled.
I know. It's the cost of everything, supplies, this stupid electronic medical record they want me to buy. I don't know. We're going to have to come up with something else.
You haven't practiced medicine in 10 years.
I know.
You're a bureau, all you do is the administration now. But that's
well,
the system.
Let's shut up. We've got people to see.
All right, go to your first patient.
All right. Knock. Oh, sorry for the wait. The office has got me overbooked again. We have to double book to make sure that we get enough patients through to pay the bills. How you been, Donna?
It's Debbie, not Donna.
Sorry. I'm tired. I was up all night. I was on call. The beeper constantly going off. And I got 40 patients lined up today, if not more. So I apologize. So what brings you in today?
I'm sorry. All these got kicked back from Medicare.
For what?
Every one of them's a different reason. They're all just nuance of I need this for documentation. You know how they are. Every single time it gets kicked back and they just want more information.
I spent 4 hours on documentation last night.
You got about another 4 to go. And for that huge reimbursement they give you, I know you're all excited about that.
Just put it on my desk. I'll get to it later.
All right.
Well, so what brings you in?
Well, I still have reflux, and my shoulder still continues to hurt. You said I probably had a rotator cuff tear during my last visit. I tried the medicine you prescribed for my reflux, and it's not working. And the physical therapy has not helped my shoulder pain.
I knew that medicine wasn't going to work, but, you know, Medicare says I have to try it, and it's never worked for any of my patients. I knew this going into it, but you have to fail on the first one before they'll pay for the one that really works. I could have saved you a whole month of suffering if they just would cover the one I know works. Well, let's see here. Oh, let me look at my computer screen here. Medicare has some questions that I forgot to ask you at our last visit. Do you own a gun?
I would never actually answer that question, but yes, I do. Why do you want to know that?
I don't want to know it, but the government says I have to ask you this question, and I have to document what your answer is. So you do have a gun. All right, let me put that in here. Has a gun. What kind of gun you got?
Debbie's not going to answer.
Oh, you don't have to answer. It's okay. Big gun, small gun?
Yes.
Okay.
10 of each.
So, do you have any mental illness?
Well, I had a bout of depression after my mother died.
Well, let me put that down.
Who has access to this information?
I really don't know, Debbie. I guess whoever's on the other end of this computer. I used to be the only one with access to your health information, but I just don't know who has access to it anymore.
Dr. Greer, I'm sorry. Some of the patients, they get a little upset. They're waiting, and they said that they're going to leave. I said I'd tell you.
Well, tell them I'm sorry. They can either continue to wait here in the office, or they can go to the ER and wait.
That's kind of what I thought you'd say.
All right. Well, you know, Debbie, I think because of that rotator cuff injury, what I presume is one, your exam says that it is. I think we should schedule an MRI because obviously the physical therapy hasn't worked and you're still complaining of pain. So I think I'm going to call Medicare and see if we can get that MRI authorized. So let me just see if I can get them here on the phone. There's two. Okay.
Renewal.
Yes, I speak English. Hi. Hello, this is Dr. Beard. Who am I speaking to? Oh, Nurse Smith. Okay. Nurse, I need to get a MRI authorized for my patient who I suspect has a rotator cuff tear and has failed physical therapy. Yep. Of course I've done an exam. What do you mean, how do I know she has a rotator cuff tear? I just did an exam. It clearly indicates that she has a significant shoulder injury. No, we've not done an ultrasound yet. I don't want an ultrasound. She needs an MRI. It's the best imaging study for a suspected rotator cuff tear. You're a nurse, I'm a doctor. What's the problem here? All right, I'll tell her. Sorry, dude. We have to schedule you for an ultrasound. The nurse will not authorize an MRI. It's probably going to be, I don't know, a week or two before we can get the ultrasound schedule, which is of no use. It's not going to show me what I need to see or what the orthopedist needs to see. So we'll work on getting that scheduled in the meantime. And I guess I should go ahead and I've got some bad news and I got some good news. What you want to hear first?
Companies were out there and employers thought, hey, this is a good way for me to give a tax-free incentive to my employees to recruit them. And they came to the doctors, the reimbursements were good. This is in the early 70s this started, and it started growing. The insurance companies came to grow more. The companies expected it. You expected it as an employee. And then all of a sudden, things started to change. The insurance companies started ratcheting up their rates, started refining who you could go to, more restrictions. And somehow, 40 years later, where we are today, where the doctor has almost no control of how they want to practice medicine. So you really go back to the future. A concierge medicine is nothing more than the way family medicine was 40 years ago, when your family physician knew you, knew your family, knew things about you.
And you paid the doctor, you didn't pay some third party. And we do things a little different at Hippocrates Health. So what makes us different, you know, and this is a movement that's kind of going across the country right now. Started up in Washington State. They're really the forefront of the movement. Arkansas has 5 concierge doctors.
There are 5,500 nationwide.
So we're a little
behind.
A little behind the times. I'm the first female physician in the state that's doing this. And what makes my practice different is I see a total of 300 patients. That's it. The typical practice has 3,000 to 4,000 patients. And they have to see that many to feed the beast, to pay the front office, to administer the insurance and Medicare and Medicaid. And
interject there. The reason that math works, 40% of each dollar goes to the insurance company for their profits and for their administration. Another 40 to 45% is on the shoulders of the doctor to have the front office, the receptionist, the people filing the insurance. All that churning occurs before you see one patient. So 85 cents out of every dollar is wasted before a doctor even gets to see a patient. That's why it's like, how does it work with 3,000 to 300? We can take 1/10 of the patients, come out with a decent living, not getting rich, but paying the doctor so they can pay their bills. There's no front office. When you call, the doctor answers the phone. It's the way it used to be. Insurance has a purpose. It needs to be there for major medical in case you have a heart attack or a car wreck. I like using auto insurance as the analogy. You don't have auto insurance for your oil change or your tune-up. Somehow insurance companies inserted themselves. Actually, the employers invited them, but it became its own beast. Now we got the government coming in. So if we have 15 cents left, we won't be able to service the debt that we have to pay, that the government has to pay to use the money. By the time we churn through there'll be pennies on the dollars left. And doctors like this are leaving because they're fed up.
It's way too much work. The patients aren't getting the care they need in 5 or 10 minutes. I'm sure most of you have encountered a similar scenario. The doctor sees you for 5 minutes, and next thing you know, you've got a prescription in your hand to treat a symptom. I don't do it that way. That's bad medicine. My patients typically spend about an hour and a half with me. I try to focus on getting to the root of the problem. We focus on a lot of prevention, lifestyle. I'm a dietitian too, so that is big with me: nutrition, exercise, lifestyle. I'm also ER trained and family medicine boarded, so I'm able to handle a lot of little emergencies that may arise. My patients have access to me 24 hours a day. So they have my cell phone number, they email me, they text me. I make home visits. Last week I had two patients that called and said they were on their way to the ER, and I said, hold on, let me come by and check you out, see what's going on. And saved them a trip to the ER, which saved them a lot of time and a lot of money, and they were very appreciative of that. I'm actually enjoying medicine again. At the end of the day, I see about 4 or 5 patients a day instead of 45. I know doctors that see 60 patients a day. I don't know. That's not good care. And if they tell you that they're giving you good care, they're lying. There's too many things to think about in 5. You just can't do it in 5 minutes. And so I'm already seeing better outcomes in this route. And at the end of the day, I have the mental capacity to research my patients' problems. We converse back and forth through email. I have them research things while I'm researching things, and it's a collaboration. It's a little team approach, and we get to the bottom of things. And also, because I do not take insurance, I'm able to negotiate cash fee rates for labs and imaging studies. And I was astounded at how cheaply I could get these things. A typical annual lab panel that your doctor would do cost me about $12. Your insurance would charge about $500 for that same lab panel. I can get an MRI. I have a contract with an MRI for Open MRI of Conway. I can get an MRI for $450,
including interpretation,
including the radiologist reading. I work with a local orthopedist that is around the corner. He so graciously lets me take my patients there. We get x-rays on his fantastic equipment for $35. And the average cost of an x-ray in Arkansas is around $340. Ultrasound, same thing, $150. Those are around $450 or so dollars. So you can see how much money is wasted on insurance. And, you know, they keep saying that the cost of health care is going up, yet doctors' salaries are going down. And I'm just wondering who's making this money. And because it's not us. Yes, sir.
Oh, I guess you already realize the libertarian position is to get the government completely
Yes.
out of health care. But it does surprise me you don't even take insurance. My question is, what is the average age of your patient? Because like everybody over 65 is qualified for Medicare.
Right.
If they have any benefits at all. So what is the average age of the people that are opting for your...
It varies. We have, my youngest patient is 2, my oldest is 73. I have several Medicare patients. They opt out. They have to opt out of Medicare. They cannot seek reimbursement for my services because I'll get thrown in jail. So they sign a waiver form.
Right.
And they just pay the monthly fee. But that still means I can still prescribe medication, still prescribe lab work and imaging that Medicare will cover. They just cannot seek reimbursement for my actual services, the monthly fees that I charge.
Medicare becomes their catastrophic coverage.
Yes, we encourage all of our patients to have.
Is that how you work at a monthly fee instead
Yes.
of like per visit?
Yes.
It's not per visit. It's a monthly fee, unlimited visits.
And our patients don't abuse it. So the idea is that you would have a catastrophic plan or a high deductible plan. You're not allowed to have catastrophic plans now because of the government. But you can go to a high deductible plan, which would be your bronze, with a $6,300 deductible and a health savings account. The health savings account you can use towards our services. You can use pre-tax dollars for our services. Your deductible should go down enough by going to a higher deductible that you would offset a lot of the costs. You can offset about a third because of the HSA, then you offset some more by going to a higher deductible system. If you can avoid just a couple of years of, you could have bad luck and have them back to back, but the idea is the HSA will grow and cover your deductible plus other things. So we don't say don't have insurance, but just like the car insurance, I used that earlier before, you use your car insurance for in case you wreck your car, not to tune it up. It'd be a very inefficient delivery system if mechanics tried to do that. It'd be also very ineffective if the mechanic was only given 5 minutes to diagnose your car. But yet they expect a doctor to diagnose a human in that amount of time. It's not the doctors. It's been like a cattle chute that these doctors have been herded down over the last 40 years, and now they're waking up.
And we're trying to help physicians out there convert their practices into this type of model. I think a lot of them are just scared, and some of them are just so invested in what they have, and a lot of them are about 3 years from retirement, and they're just kind of waiting it out, and then they're gone, if not earlier.
But if you have someone, I'm an expert in insurance, I can help them move along, and I don't want any money for it. We believe so much in this movement, we will help convert doctors.
And there are people who are approaching us daily, lobbyists, politicians, so I know we're on to something. And I don't want this movement starting there. I want it to come from the doctors.
I was kind of going to ask along that, the fiscal session is coming up, and of course one of the issues would be funding for private option, but of course budgets they're having budget hearings right now. Fiscal session that could help you all.
Well, it's right now it's hard to say who the enemies are.
Leave the doctors alone would be the first thing.
That would be an excellent thing to do.
That's the first thing. I mean, this is just obvious where this is going, because if you don't have this type of service or doctor within the next 5 years, you're not going to be seeing a doctor. You're going to be talking to a computer or somebody that's writing down off a computer, and then you might get to a doctor, but by the time you get to a doctor, you could be dead and gone. I mean, there's not enough doctors in the system to take care of the demand that is going to be there. That is astronomical. And I personally have this service, so I can say right now, I think, especially with someone who is actually a dietitian, with so much going into everyone trying to control their diets and understand how to do this, this is a perfect balance, in my opinion. And I just think it's the only way most of us are going to be able to
That's a better way to ask the
doctor.
question is, what department would you like to see funds cut in that gets in y'all's way?
What's getting in our way right now is, first of all, in the Affordable Care Act, there is a paragraph that says that our services, combined with a catastrophic health insurance plan, could meet the mandate. and it's supposed to come from Health and Human Services. They're not giving it to us. So that's one thing we need desperately. Because right now,
We need catastrophic medical plans.
with an HSA.
With an HSA.
Right now, you have to do the bronze plan, so you're double paying for the wellness visits, for maternity care, birth control, all things you may or may not need. Everything's included in order to make this. They've done this for it to collapse. I mean, they're trying to do this to make it where we're so far down the path, like, well, now we just have to cut out the insurance and we'll make it a single payer system. But what they don't know is a lot of doctors are going to opt out. Then the next question is, are they going to try to force the doctors to see the patients? And that's where the...
That's something
And that's
that
when I
could be
die.
forced in terms of funding some of these.
Well, they control the licenses, so
Yes,
that's
everything's connected to our license. And there's a huge push on the left, well, not a huge push, but there's several people on the left who want us to be forced to take the government insurance.
Right.
And the patient-doctor relationship is one of the most important relationships there is. And to have someone force you to see somebody that you do not want to see is a travesty, and it won't work. It's not goodness.
Their idea of the way they want to improve the efficiencies is to have one doctor with a team of nurse practitioners and physician's assistants and supposedly quarterbacking them. That's great for scrapes and bumps and cuts. They're excellent at that. But to get to the root of your problem, they're not doctors.
No.
And the doctor being an administrator is not going to be able to sit and research your problem. You know,
And it's a big waste of medical training to be an administrator. I did not go to medical school residency and put all the hours I did into this to push paper around.
So through the local Tea Party in Faulkner County, we've contacted our local representatives that are like-minded, and so they know what we want. In fact, we just met with them last Saturday to say, hey, here's what we need, and they understand. It's just a matter, and it's all about the private option, and we'll just see how things shake out. But we do have people representing us, and we'll see. It was ironic that we saw it was a former state senator that approached us through another businessman, and they want a piece of the action, saying they'll help us grow. And I'm like, where did you come from, and why would we want to marry up? Like, you build the model to show how it's successful, and then we'll help you roll it out. I said, well, that's kind of what we're doing.
We don't need your help.
I mean, so I think, and that's one of the reasons I want to volunteer my services to help other doctors convert. If you have a good primary care physician that you like, mention to them, like, have you ever thought about direct primary care or concierge medicine? They're the same thing, but it just means that you don't take insurance directly.
And if they're interested, please have them call us.
And so these people will help you free of charge. It is easier than they think. Doctors are usually not good business people. You shouldn't have to be. You're supposed to be a doctor. But they ask them to be a doctor and a business person. It's the same thing they do to farmers. They want to be a farmer and a business person. Cut it off. All right.
Oh, we're already past. I was just going to wait till it got enforced.
Oh, okay, well,
Everybody wants to ask me.
I'd like to say thank you, Paul and Dr. Beard, both for coming in and stopping call. I was about to pleasantly surprised to find out y'all were when I got the email today. So.
Well, the reason we're late,
And patient.
she stayed to stay with the patient. Because the patient came in, we wanted to be there.
I'd also
We walked the walk.
I'd also like
That's a good reason.
I'd also like to thank you,
Bring a card.
Mark
Yes,
Martin,
I have
for today. Thank you for coming.
Hey, I appreciate the invite.
Yes, thank you for coming.